The literal meaning of the word doctor actually means to teach. So one of the most important things I can do for patients is to teach them. So we use this model of the spine, and ideally we want symmetry in our spine. So when we turn our head to the left and the right, we want perfect symmetry. Each vertebrae should move a certain amount. And when a patient comes in, we're looking for restriction in the spine. When we look at this model, each spindle here represents a vertebrae in the spine. When you have pain, when you move, certain vertebrae in the spine do not move and do not function the way they're supposed to. Then we apply an adjustment to the spine, and ideally what happens afterwards is then the spine starts to function more properly again. The most common problem I see is lower back pain. Mechanisms of movement in here get restricted over time for different reasons. Slips and falls, maybe a person crosses their right leg over their left all the time, and that causes certain muscles to become tighter than others. That has an effect on our spine. The certain movements in here will be restricted, and again, there's mechanical reasons for their pain. Now, there's also other reasons for back pain, but we do diagnostic studies, we take x-rays, we do an examination on the patient to find out if there's anything else going on with their spine. One of the concerns of patients is that they think chiropractic is going to hurt. They think the adjustment itself is going to hurt them and cause them to have pain when I do the adjustment, because you hear this sound come out of the spine. But what that sound is actually freeing up the joint. It allows that joint to start moving and functioning better. As soon as I apply the adjustment, it gives a feeling of relief, really, and they have better range of motion afterwards. Ideally, people feel better after their first adjustment. Some people are sore. Probably 20–30% of my patients have some kind of soreness after their first adjustment, because all of a sudden we're creating new function in an area that hasn't functioned for potentially many years. So the muscles around there are going to be tight, and we're placing new demand on those muscles. The ideal scenario after I work on a patient is to see about a 50% improvement in their pain after 2 weeks. Say a person's 50% better or 50% less pain after working on them for 2 weeks. Over the course of a few more weeks, it's going to get less and less and less. We're going to teach them how to do stretching exercises and strengthening exercises to improve that even more.